Hi, everyone, and welcome to episode 143 of the Veterinary Behaviour Chat podcast. And in this episode, I want to chat a little bit about when caregivers and or professionals potentially perceive medication, behavior meds specifically, have stopped working. So what I'm not talking about is a medication that perhaps hasn't been the right medication, that hasn't really had the desired effect for the patient, but really those patients where meds have had a really good effect, and then all of a sudden there's the perception that they've stopped working and that they no longer have a good effect. And this episode was inspired actually by a consult that I saw just yesterday, where exactly that was the case, where a patient had been started on fluoxetine, and after 3 months, they saw really great improvements, real kind of decrease in impulsivity, anxiety, and fear. The dog was much, much more able to cope. And recently, they have found that the meds aren't working so well anymore. Anyway, that was their perception. And that's why they contacted me, is because they thought, it was working, now it's not. What's the problem here? And I'm going to give you sort of my 5 big groups of reasons why that perception might come about. I'm sure that's not an exclusive or exhaustive list, should I say. I'm sure I've probably forgotten some, but these are the sort of the big 5 that come to my mind. But before we go there, what I actually want to quickly start off by talking about is, what does that actually mean? So when somebody comes to you, whether it's a caregiver or a professional, and says the meds have stopped working, what do they actually mean by that? And that's why I kept referring to it as the perception of the medications have stopped working. And usually what's actually happened is that the caregivers and or the professional has noted a deterioration in behavior. So behaviors got worse. And therefore the conclusion has been, well, it has to be that the meds have stopped working, because they did work initially. We got some really nice results, and all of a sudden they're now no longer working. Or all of a sudden behavior has worsened, or behavior has regressed or deteriorated, or maybe new unwanted behaviors have emerged. And surely that then has to mean that the meds aren't working anymore. So that's a little bit what's brought to us during a consultation, right? That'll be the story that you're told. That'll be the complaint or the concern that you're presented with, is the meds have stopped working. And before you actually go down the route and think, crikey, have the meds really stopped working? Why have the meds stopped working? I want you to have a think about what could be the other reasons for the deterioration in behavior. And as we all very well know, medications on their own are never a successful strategy. That's not what a veterinary behavior treatment plan looks like. We know that there are so many other pieces that need to fall into place to improve behavior. And, and I'll talk about 2 of those pieces when I come to my list of 5. But that really is the crux of the matter. I think it's very easy to blame the meds, right? It's really easy for many things, XYZ has happened. Is that because of the fluoxetine? And sometimes it is, my patient started vomiting, decreased appetite. Is that because of the fluoxetine? Yeah, absolutely. It could be. But I've had a number of cases where people have contacted me, in alarm. We've started psychopharmacology, and all of a sudden their pet hasn't been well, or something else has happened. And it's very easy to jump to the conclusion, well, it's because of the medication, the psychopharmacology in particular. And I can remember one case I had where the dog was really quite poorly, quite flat. And it was probably within the first weeks of initiating psychopharmacology. And the dog was, like I say, really flat, really poorly, didn't want to come out of their crate. I was contacted by the caregiver. Number one, I thought, crikey, a few weeks in, that's a bit unusual. Surely if we were going to see side effects this extreme, that would have happened straight away. And then I said, look, you need to go and get this was a dog, you need to go and get your dog seen by a vet. And then as it happened, the dog had a really high temperature, a fever, and had an infectious something going on. I think it might have been actually a urinary tract infection. I can't remember exactly, but it was something like that. So a completely unrelated problem However, the meds were blamed in the first instance. So I think, when we're contacted by caregivers in particular with like, my dog's not well, it's got to be the meds, I think absolutely we have to think, could this be the meds? Is this a side effect? Is it the right timeline? Is it sort of quite soon after starting, or a dose increase of the medication? Is this a known side effect? Is this something that absolutely we could attribute to psychopharmacology? Or does this look completely unrelated? So that's one of the big kind of pieces that we have to try and tease apart to try and figure out what's going on. However, back to my five big kind of causes why a caregiver and or professional might perceive the fact that the meds have stopped working because behavior has deteriorated. So the first big kind of piece would be the timeline. So if it's quite soon after starting medication, and you may have heard me talk about this before, it's quite possible that the side effects that showed up in the first couple of weeks after starting medication were actually really desirable side effects. So imagine you've got a dog who's hyperactive, hypervigilant, can't settle, pacing, panting, constantly patrolling the house, the garden, whatever it might be. You start, let's say, fluoxetine, and one of the side effects in those first few weeks is increased lethargy, a little bit more drowsiness, and all of a sudden these unwanted behaviors reduce due to the side effects. The client thinks, amazing, this is a brilliant medication. They really like the effect that they see in weeks 1 and 2. And then in weeks 3 and 4, those side effects lift, and the patient kind of goes back to more of those behaviors. So more pacing, more panting, more hypervigilance, and so on. And that's just because the side effects have lifted, and not yet because, we haven't yet seen the true effect, because that takes about 4 to 6 weeks. But in that week 3 and 4, you'll commonly hear caregivers come back and say, the meds have stopped working. They worked brilliantly in the first couple of weeks, and now they've stopped working. And my dog is back to as bad as they were before. And then this is also sometimes when people will say, I think my pet has gotten used to the medication. I think the body's gotten used to it. Do we need to increase the dose? And that's when I come back and say that's really rare in many, many psychopharmaceuticals. In fact, the only psychopharmaceutical where we can perhaps think about adaptation or dependence would be the benzodiazepines. I would say all of the other medications that we commonly use, they don't have that effect. So it's not that the body becomes used to the medication or there's a dependency and therefore we need higher doses or whatever. So that really, in my mind, is reserved mainly for the benzodiazepines. However, when a client says this about an SSRI or a tricyclic antidepressant or an SNRI, you can be quite sure, and if it fits in with this timeline and time frame, you can probably be quite sure that this is a lifting of the side effects that were somewhat desired. So that would be the first thing that I would think about. Where are we in the timeline? What's happening? How long has this patient been on for? Could it have been a side effect that was quite nice and that's now lifting? Then the second big piece that I look at is, and this is where we start to think about that bigger picture treatment plan. Has anything changed in that pet's either physical health or in their environment or in their social interactions? So remember, two really big pieces of the behavior treatment plan are management of the environment, management of social interactions, management of exposure to triggers, all those sorts of things, managing situations in a way that reduces arousal and stress. And if that is something that the caregiver does, very sort of diligently at the beginning of the treatment plan, the medications start to take effect. We've got this great management protocol in place. The pet starts to get a lot better behaviorally. And all of a sudden the caregiver thinks, oh my God, they're doing so well. And then they start to let things slide on the management side of things. then yes, we may see behavior deteriorate, because management is as important as the medication piece when it comes to treatment. And this actually is what I think happened in the case that I saw yesterday, is that we had really great improvements by month 3, and then we had a little bit of loosening of criteria when it came to management. The management was less stringent. The caregivers thought, oh, they're so much better, we don't need to take so much care about the management anymore. And then behavior started to deteriorate. So management is one. And then physical health is the other big one here, right? And this is oftentimes where a patient has been doing really well behaviorally, has been stable for a longer period on their treatment plan, which may include medications. And then all of a sudden we have a physical health piece come in, like that dog that I mentioned earlier, that all of a sudden has a concurrent infection. This can happen at any time throughout that animal's life. Or we suddenly have the onset of pain, whether that's dental pain, whether that's, ear pain, whether that's skin-related pain, whether that's musculoskeletal pain. All of a sudden we have the onset of pain. And so that might be, perhaps at a different life stage. So maybe we saw the dog when it was a younger dog, behavior's been stable, and all of a sudden we see deterioration, maybe as osteoarthritis develops, or we've got GI tract disease. So physical health is often what will cause behavior to deteriorate in a previously stable patient. So all of those things, management, physical health, but also, has the environment changed? Have there been new challenges from the environment? Have there been new challenges from a social aspect? Has a baby joined the home? Have the caregivers moved house? Have the elderly parents come to stay, with the caregivers? Have there been lots of visitors? Has it been a busy period with maybe many birthday parties or something like that? So what else has been going on that might have contributed to behavior deteriorating? So I think that's a really, really important piece. In cats, this is such a classic one. I've got a number of really great clients and patients where we've got, one cat being perhaps quite worried about the presence of other cats, and there might be some household cats, and we've kind of done really well in managing that, and the cats that live in the home are all getting on really well with each other. We may have used medications, we've optimized resources and so on. And then all of a sudden, a new tomcat moves into the neighborhood and everything goes awry. All of a sudden, we've got massive deterioration in behavior. We've maybe got, aggressive events starting up again between the cats. And that's because of this added environmental and social pressure of, outdoor cats coming into the area, all of a sudden coming into the garden. And we know that that's something that's really difficult to control. And I see that so much in the UAE, that piece of, because we've got so many street cats, garden cats, unowned cats that are just popping up all over the place. And that can be really challenging for these households that have worked so hard to recreate harmony amongst their own household cats. And then all of a sudden, these outside cats come along and disrupt the balance, and it all goes to pot. So, and again, sometimes it has been, do we need more medication? Is the medication not working anymore? But actually, no, in that case, it's been the environmental load, that environmental trigger that's caused behavior to deteriorate. So that would be my second big thing. My third big thing to look at would be life stages. So if we have a young dog that is behaviorally challenged, let's call it a 4, 5, 6 month old dog, and we initially make some progress with, changing behavior, improving behavior, and yes, we may use medications, and then that dog enters into adolescence, and as it goes through adolescence, behaviors either plateau or deteriorate again. And that is due to what's going on in that animal's brain at that moment, that whole remodeling that we know goes on during adolescence, and not just in their brain, but also in their physical bodies. We have perhaps growth going on. We've got a change in microbiome. Like, there are so many things that can happen during this life stage. So sometimes we have to ask ourselves, well, if behavior is not improving, even though we've got a brilliant treatment plan in place and behavior is not improving, are we actually still winning because we're keeping this pet in a steady state as opposed to them deteriorating? Or is behavior maybe deteriorating because that additional kind of life stage load is so great? So that's one life stage I would think about. And then the other life stage I think about is as pets become senior pets. So do we have, and again, this might be a pet that has been, previously behaviorally challenged, but we've managed to stabilize them really well. They've been stable over a number of years now. And all of a sudden, as they start to become senior pets or older pets, behavior deteriorates. And again, that takes us back to our physical health piece. Do we have pain? Do we have osteoarthritis? Although OA is not just an old age disease, but is that something, to think about in cats, for instance, especially, or do we have emerging signs of cognitive decline or cognitive dysfunction? Is that why behaviors are deteriorating? So we need to start digging into what else is going on and identifying that life stage as being a potential contributor. So I think that's a really big third one. A fourth one that has sometimes happened to me, that's happened to me on occasion, is where the medication brand has changed, right? So maybe a pet has been on fluoxetine, one particular brand forever, or maybe, they've been on Reconcile for a long, long time. All of a sudden there's been a shortage in supply and we've had to change them onto a different brand. And now all of a sudden behavior is deteriorating. And in this case, we maybe could say, right, the meds aren't working, or it's the meds, that it's truly the meds because it's a different brand and maybe the bioavailability is different. That is in particular the case maybe from if there's a change from Reconcile onto a more generic brand of fluoxetine. So that's something to consider, because that's caught me out a couple of times actually, where especially in some countries like in the US where patients can fill their prescriptions through a pharmacy, or where the GP vet is filling that prescription, I'm recommending it, and the GP vet can't get one particular brand, so now they've just switched onto another, and I haven't been informed about that, and all of a sudden things are kind of deteriorating, and I'm thinking, gosh, nothing's changed. It's not a side effect. Physical health hasn't changed, the environment hasn't changed, nothing's changed, the life stage hasn't changed. And then I'll ask the question, have you gotten a different fluoxetine or a different medication, whatever it might be? And then, oh yeah, actually no, we changed onto a different brand because the other one wasn't available. And so that absolutely might be the case. So just watch out for that one, because like I say, I've been caught out a few times by that, and then it's been like, oh, okay, that's what happened. So remember to ask that question. And then the final piece I want to talk about, my fifth point, are drug interactions. So we're thinking about a patient that has been on, I'm going to just stick with fluoxetine for this episode because it's the easiest example. We have a patient that's been on fluoxetine for, again, a period of time, and we see behavior deteriorating. And as we question that, then that pet has potentially been put onto a different medication concurrently. Now, I'm going to kind of dive a little bit into the into the biochemistry of this. And I want to talk in particular a little bit about the Cytochrome P450 system. So this is actually a super family of enzymes that is responsible for the metabolism of about 80 to 90% of the medications that we give our patients. And they live in the liver. So it's a liver-based enzymatic process of metabolization. And what's really interesting about this Cytochrome P450 system is that some medications can act as inhibitors and some medications can act as inducers. And the ones that we really want to be thinking about here are the inducers. So what does that mean? Well, inducers can actually increase the metabolism of a different medication, let's say fluoxetine, and therefore reduce its therapeutic concentration in the blood. And so what are some of the inducers of the Cytochrome P450 system that act on fluoxetine? Well, they can be medications such as phenobarbital, carbamazepine, also glucocorticoids, so steroids, and St. John's wort. So that's more of a kind of a supplement. But if any of these things are given in addition while the patient is on fluoxetine, let's say they develop a seizure disorder, and they're started on phenobarbital, or they have an inflammatory skin flare-up and they're started on glucocorticoids, or they're given a supplement that contains St. John's wort, and we know all of these are inducers of the cytochrome P450 system as it relates to fluoxetine. That means that fluoxetine's metabolism is going to be speeded up, and therefore we don't have as much therapeutic concentration in the blood anymore. So it's really, really important to ask the question, has the pet started on any other medication or supplement recently if the client, the caregiver, perceives behaviors to be worsening? Because it could just mean that whatever it is that they're being given is speeding up that metabolization process, and we haven't got in as much fluoxetine in the blood anymore, and we don't have that therapeutic concentration, or we have a reduced therapeutic concentration in the blood. So it's really important to sort of know the inducers for some of our most commonly used psychopharmaceuticals. And it's a bit of a bitty list. I mean, we had to study this for our board, so I know how involved and complex this is. It's a pretty complex system, and for anybody who would like to, please, go away and dive a bit deeper into that. But I do feel that for the medications that we most commonly use, so the SSRIs, the most commonly used tricyclics, if you're using venlafaxine, for sure venlafaxine, and maybe even some of the other more commonly used short-acting meds, trazodone, maybe gabapentin, although gabapentin isn't metabolized that strongly in the liver, then I think it would be really, really useful to know at least some of the most common inducers. So those things like for fluoxetine, phenobarb, carbamazepine, steroids, St. John's wort, right? Like all those things are pretty important to know. On the other hand, we can also have inhibitors. So remember I said we've got inducers and inhibitors of the cytochrome P450 system. And inhibitors do the opposite thing. So they decrease drug metabolism. We therefore then have a higher concentration in the blood, and that then has a potential for toxicity. Again, it's probably not something that we would worry massively about in our psychopharmaceuticals because we do have quite wide dose ranges. But let's say, for example, you're using fluoxetine in a patient that maybe has hyperactivity, hypersensitivity disorder, and you're using it at a high dose, like let's say 4 mg per kg. If you then add an inhibitor and you make available even more of that of that therapeutic concentration in the blood, then that might be a risk for serotonin syndrome, for example, right? So those are just some of the things that we have to bear in mind. But for the purpose of today's episode, which is the medications have stopped working, it's the inducers that we really want to be thinking about. So, I mean, this is quite a sort of a deep divey one, and I would definitely be looking at the other 4 things first, maybe. But if you're really scratching your head, if this patient is just worsening and there's nothing else that you can think of, make sure that you ask those final 2 questions. Has the medication brand changed? And has the patient started on any other, not just medication, but also supplement? Because some of the supplements contain ingredients that are really quite sort of active in the body and that can have quite significant effects. So those would be the sort of a little bit outlining the thought process that I go through. I was going to say my like top 5 things to think about, but obviously, it's never as easy as 1, 2, 3, 4, 5. You have to kind of go through a bit of a thought process as to why this might be happening. Ask the questions: what else is happening in that patient's life? What else has anything changed? What else has changed? Have they started with a new trainer? There may be aversive interactions going on. Like, there are so many possibilities why behavior may deteriorate that we can't always go ahead and blame the meds. And we need to really go through that sort of comprehensive questioning process. And it can be hard sometimes, right? Like when you get that message of, oh, the behavior's worse, the drugs have stopped working, like nothing's working anymore, or my pet's not doing well, they're unwell. Is it the fluoxetine? Is that why they're doing this? Then you just have to take a breath, take a step back and think, hang on a minute, what else is going on here? And what else could be contributing to this patient's change in behavior, whether that's, a deterioration of true behavioral signs, or whether that is the pet, in inverted commas, not being well, or the caregiver just being really worried because they're flat lethargic, something else is going on. So important to try and tease all of that apart. Okay. I hope that's been helpful. That has been a bit of a deep dive into, and it's really interesting and important, isn't it? This, when you start working practically with these medications and with these cases, these are the things that come up that will kind of stump you maybe in the first instance. I know they did with me when I started my residency. I was like, oh my God, I've no idea. Like, is the medication stopped working? I don't know. Is this a side effect? So just, stop and think and take a breath and just work through it logically and bit by bit, like you would any other medical case that you're working through. All right. Hope that's been helpful. And I very much look forward to seeing you next week for episode 144. Bye for now.